First, it was 7-year-old Avinash. Now, 6-year-old Aman has died of dengue in the national capital after he too was turned away from various hospitals and denied treatment. Calling the deaths heartbreaking, Chief Minister Arvind Kejriwal has talked about penalizing hospitals that turn patients away, even bringing in a law that would enable the government to take over private hospitals if that was the case. The centre, meanwhile, has also stepped in and demanded to know what exactly has happened in both these cases. Well, we have Dr. Sheetal Sabharwal of the Jeevan Hospital who's joining us here in the studio. The Jeevan Hospital was one of the hospitals that Aman went to. Ashish Khaitan of the AAP also with us tonight. Let me ask Dr. Sabharwal first. At what point did Aman come to you? Because your hospital isn't fully equipped to deal with this, with the issue with dengue. And you had actually said that he needed full-fledged hospitalization. What happened?
Well, first of all, I wouldn't say that we're not equipped to deal with dengue. We are admitting a lot of dengue patients and also treating them and giving them good quality care, because most of the dengue patients require a primary or a secondary level care, and that is what we are doing.
Not critical.
So now this child was admitted on the night of the 11th when the platelets were around 40,000. Platelet transfusions were done and the pediatrician was looking after the child. But on the night of 12th or the early morning of 13th, she got a call saying the child was very breathless. When she went, she felt that the child may be developing respiratory distress. She thought that the child may need ventilation, a pediatric ventilator, and that was the point when the child's father himself came forward and he said, "Doc Sahab, you please refer my son to a higher center for a tertiary care." And that is why the decision...
You don't have a pediatric ventilator in your hospital?
No, we have an adult ventilator, but we do not have a pediatric ventilator. And when the decision was taken, the child was not critical at that point. So the child was referred for tertiary care.
So were you shocked? Because after that, they apparently went to Mulchand Hospital.
Yes.
And you know, from there, it's a downward spiral because he was turned away from Mulchand. And does that shock you that they were told that there were no beds there?
Well, this child's father had said that I have made arrangements for the child's admission, because he even refused the hospital ambulance when it was offered to him, and he said, I have my own arrangements and I want to take the child, and he took the child away. We did not know about what had happened until the child passed away 36 hours after he was discharged from our hospital. So it was a surprise, but you know, in a case of dengue, it is not a big surprise because dengue can go bad at any time, especially in children and younger children. The platelets were already 40,000, it might have gone down, and it's not so surprising. Considering that the child was in hospital ultimately, he was in Holy Family, I believe, and he passed away.
Yeah, but at the end of the day also was waiting for care at Safdarjung.
Yes.
Was told at Mulchand that there are no beds. Your hospital couldn't treat him when it became too critical. Don't hospitals have to take responsibility for the death of this young boy?
The child was referred when the child was not critical at that point. The thing is that yes, he spent a lot of hours on the road shuttling from Mulchand to Safdarjung, and maybe the child got dehydrated at that point, because dehydration in dengue can really make a child very critical.
Yeah, and therefore you've said exactly what we're worried about today. Ashish Khaitan. Okay, we're talking about this for the second night in a row. It is actually a very heartbreaking story, as Arvind Kejriwal was saying today as well. But Ashish Khaitan, today there's a lot of anger among people about what the Delhi government is doing, about the hospitals that come under the Delhi government at least. Forget the central government hospitals. Today people are asking if the Aam Aadmi Party can spend 500 crores on government ads. What is the amount of money that is being spent on making people aware about dengue, the precautions to take, what to do, and what care to take? Do you have a figure for us on that, Ashish?
So the government is working overtime. The government is working day in, day out to fight against this problem of dengue. You must be aware that the Chief Minister himself, the Health Minister himself have been going and taking rounds of the hospitals. All hospitals have been equipped, government hospitals have been equipped to treat dengue patients. There are enough number of beds. More beds are being arranged to treat dengue patients. Fever wards have been created in government hospitals. There is a helpline which is working. All the leaves applications have been cancelled. All the paramedical staff and doctors have been told to not take any leave. And so all possible help and all possible directions that the government can take are being taken Private hospitals have been issued directions to not turn away any patient. We are coordinating with the MCD. Instructions were issued to MCD and private hospitals in the month of July. They were followed up in the month of August. They are again being issued, and even as I speak, there are meetings taking place between private hospitals and the health minister. So the situation is under control, and we'd also urge you as a responsible media house that please help the Delhi government, help all the agencies who are trying their best to fight against the menace of dengue. Please make people aware, and please tell them that dengue doesn't necessarily mean that you have to press the panic button. In 95 or more than 95% of the cases, dengue is controllable and does not need hospitalization.
I think those are important points that you make, and therefore I want to also take this to Sambit Patra of the BJP, that Sambit, at this point we've also seen politics being played out over this issue between the BJP and the AAP. But I urge both parties, and I urged this yesterday as well, that you need to find a way to work together with the Delhi government and just help people. You know, people are in a state of panic. They shouldn't be. You're right, they shouldn't be. But people are worried. People are really, really worried. They're queuing up outside hospitals at the slightest signs of fever. And this is the time when the centre really needs to work with the state to find solutions. Sambit, can that happen?
The centre, in fact, has been working with the state right from the very beginning. And in fact, the centre has issued right from the month of March approximately 12 advisories, has reviewed, has umpteen number of review meetings with the various sections of the Delhi government, and in fact all the kits required, be it the IgM kit that is required for the detection or be it the NS1, everything has been provided to the Delhi government, and the Sentinel Surveillance Center where these tests can be carried out has been provided. That bed should have increased, that hospital should have increased bed capacity. That has been done. But the biggest issue is over here, look, I mean, we have been saying, since I'm a doctor also, and you would agree to this fact, that dengue is a disease which has a preventive aspect, which has an aspect where people in fact should be made aware well before the disease breaks in as to what they should be doing to prevent dengue, A, and secondly, if at all they get a fever, which they suspect it to be dengue, what they should do then. And this is where the government comes in. This is where the government in fact should be making people, the citizens, aware. Now my simple question is, though not trying to politicize, 526 crores spent by the Aam Aadmi Party, but I did not see a single hoarding throughout this whole tenure. The whole place of Delhi, there a single hoarding says that this is what is to be done. These are 7 target hospitals of Delhi where the parents should take their children if at all the child is suffering from dengue. Now, contrary to this, look at all the advertisements, including the advertisement that has been run on your channel, Nidhi, since the month of June, for 3 months consecutively, is the advertisement that is being given by the central government. So everywhere the central government is playing a positive role, where the Aam Aadmi Party has woken up late. They were all busy in things which I should say was quite political, and today suddenly an advisory has been issued by the government that the students should wear full sleeves. Sir, this advisory should have come 3 or 4 weeks before today, that students in the government school should be wearing full sleeves and full trousers. That surprise checks in the hospitals are taking place. Sir, with due regards, all these surprise checks should have been taking place way back. And thirdly, there is a hospital called as Janakpuri Super Speciality Hospital, which is a huge super speciality hospital. Beds are vacant. The hospital has not yet been started. The Aam Aadmi Party had always said that it is an innovative government, so I would request them that you could have started this hospital, all the beds, I mean the hospital are lying vacant, there are no doctors over there, so surely it would have come handy.
It's equally true for hospitals under the centre. Look at what happened at Safdarjung. I mean, this family was waiting at Safdarjung Hospital for more than an hour. They were waiting, and then they moved to Holy Family Hospital where the boy died. So, I mean, let's not, can we not make this about centre versus state? The point is, Safdarjung is in a terrible state, RML is in a terrible state, so is AIIMS, and so are Delhi government hospitals and private hospitals as well. And do you believe, let me get Dr. K.K. Agarwal into this. Dr. Agarwal, what Arvind Kejriwal has said today about penalising private hospitals and possibly bringing in a law to take them over in times of crisis, do you agree with that? Is that the only way? If private hospitals indeed have beds that are vacant,
no,
I'm sure many don't, so I'm sure many don't, but there are others who do and are not giving beds, particularly to people who are underprivileged. Dr. Agarwal.
I don't think so. That is the answer as on today. The law is already there. Supreme Court guidelines are already there that in emergency you cannot deny the first aid. What is important today is what Kejriwal government has to do, that Indian Medical Association, Delhi government, MCD, NDMC and central government and all the hospitals association, we need to sit together and come out with a policy and come out with guidelines for the public with a common ad. The advertisement now should contain the signatures of all the stakeholder parties, whether it is Indian Medical Association or Delhi government, MCD, NDMC or Bharat Sarkar. We need to have a one voice. Public need to know when not to get admitted. This shouldn't happen. You are admitting patients who don't need admissions and you are not getting beds for patients who need admissions. First aid, everybody must know that for first aid I don't need a critical bed. I only need to give 20 ml of fluid per kg as STAT bolus dose. And number two is platelet count is not to be panicked upon. Platelet counts are not reliable. Public message, the government, instead of penalizing private hospitals, the Association of Private Hospitals, Indian Medical Association, MCD, NDMC government and central government should come out with a positive campaign in the society with signatures of everybody, where everybody agrees that this is how it has to be.